my name is Stephani Neuro. I am a PA student working with Dr. Courser today. And what's your name?
Brooke.
All right, nice to meet you, Brooke. And what is your date of birth?
January 15, 2000.
All right, awesome. And then I just let all my patients know my pronouns are she and her. Do you have specific pronouns?
Same thing.
Great. So it looks like today we're going to be doing a neuro exam, and that's going to consist of like testing your reflexes as well as any sensory perception as well as like motor skills and stuff. Okay?
Mm-hmm.
Do you have any questions or concerns before we get started?
No.
Awesome. All right, so the first thing we're going to start with, I'm just going to go ahead and evaluate the patient's dress, groom, hygiene, which is all looking great. And then also assessing their speech as they were talking to me and their level of consciousness. And then, so I'm just going to have you restate your name once again.
Brooke.
All right, and where are we right now, Brooke?
St. Scholastica.
Perfect, and do you know the date?
It is October 26th, 2022.
Perfect, and how about the day of the week?
It is Wednesday.
Perfect. All right, so I'm going to go ahead and name 3 different objects, and then I'm going to have you repeat them back to me.
Okay.
So table, ball, and fork.
Table, ball, fork.
All right, and one more time, table, ball, and fork.
Table, ball, and fork.
All right, perfect. So now I'm going to have you go ahead and spell the word world backwards.
D-L-R-O-W.
Great. Good job. And then what were those 3 words that I gave you earlier?
Table, ball, and fork.
Good job. Perfect. All right, so then I'm just going to have you go ahead and name a couple of different objects.
Okay.
What is this?
That is a pencil.
Perfect. And how about this?
That looks like a tape dispenser.
Yes. Great. All right. Now I'm going to go ahead and have you repeat after me.
Okay.
No ifs, ands, or buts.
No ifs, ands, or buts.
Awesome. All right, next I'm going to give you 3 different commands, and I want you to go ahead and do them, okay? So I'm going to have you stand up. I'm going to have you go ahead and pick that piece of paper off the floor and fold it in half. Great. Good job. You can go ahead and take a seat. All right, so next thing I'm going to have you do is go ahead and read this sentence and follow that command. Great. So it says close your eyes, and she did that. Awesome. And next I'm going to have you go ahead and write out like a 5-word sentence for me. Perfect. And so just making sure that it is legible and it makes sense, that sentence. It looks great. Next I'm going to go ahead and have you copy these shapes up here, right down here. Great. And what is the shape in between those 2?
A rhomboid.
Perfect. All right, so next we're going to go ahead and move on to some sensory perception tests. So first thing I'm going to start with is a sharp and dull test. And so if you could just stick your hand out just so you know this is sharp.
Okay.
And that is dull.
Great.
All right, so I'm going to have you go ahead and close your eyes, stick both your arms out. Great. And you let me know if it's sharp or dull, okay?
Mm-hmm. Sharp.
Perfect.
Dull. Sharp. Dull. Sharp.
Yep.
Dull.
Yep.
Sharp. Sharp.
Yep.
Dull.
Sharp.
Dull.
Yes.
Dull. Sharp.
Great.
Dull. Dull. Sharp.
Great. And then I'm going to have you sit up a little bit so I can do your abdomen.
Mm-hmm. Dull.
Great.
Probably sharp.
Great.
Dull.
Great.
Sharp.
Great. All right. So we are all done with that one. Next, I'm going to go ahead and do a warm and cold test on you. So this is going to feel cold, and then and this is going to feel warm.
Your hands are so cool. Okay.
All right. So I don't know if that's going to feel. Let me just warm them up a little
There
bit
you
more.
go.
Sorry about that. Okay. All right. So I'll have you close your eyes again.
Cold.
Great.
Water.
Okay. So yeah, we're gonna redo that.
Just do this as warm.
Okay. Yeah. And then my hand is gonna be cold because they are very cold.
They're
Okay?
so cold.
That is cold. This is warm.
Yeah.
Got it?
Yep.
All right.
Cold.
Yep.
Cold.
Great.
Warm.
Great.
So cold.
Yes.
Cold. Warm. Cold. Cold.
Great.
Cold. Cold. Warm. Cold.
Yes.
Warm.
Great.
Cold.
Great.
Warm.
Great.
Oh, warm.
Great. All right. All right. The next thing I'm going to be doing is some light touch.
Okay.
And so I'm just going to use the back of this eraser, and that is light. Okay.
Great.
So let me know when you feel it. Close your eyes again.
Yep. No. 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 No.
Great. All right. All right. The next thing we're going to be testing is making sure that you feel the vibration through your hand or through your feet when I'm using this tuning fork. Okay.
Great.
So I'm just going to have you stick your hands out. All right, and close your eyes again. Let me know if you feel anything. Okay.
Yep. Yep.
Keep your eyes closed.
Mhm. Yep. Yep.
Awesome. Perfect. Next I'm going to do some position tests. Once again, I'm going to have you close your eyes and you let me know if I'm either lifting your finger up or down, okay?
Okay.
All right.
Down.
Great.
Up. Down.
Great.
Up.
Great. Now I'm going to do that to your feet as well.
Mhm. Up. Down. Down. Up.
Great. All right, so next thing I am going to be doing is I'm going to be giving you a couple different objects and I want you to identify them with your eyes closed, okay?
Okay. That is a marker.
Yes, it is.
That is a paperclip.
Great job. All right. Next thing I'm going to be doing is testing your sensation of your hands. So I'm going to write a number in your hand and I want you to go ahead and let me know what that number was.
Okay.
All right, close your eyes. Perfect.
0.
Yeah, great job.
2.
Great. All right. The next
Was
thing,
it an 8?
yeah.
Okay.
Next thing I'm going to do is a discrimination test.
Okay.
And so I'm going to be tapping your shoulders, and you let me know if you feel both my hands or just one.
Okay.
Okay?
Both. 1. Both. 1. 1. Both. 1. 1. Both. 1. 1.
Great. All right. Next, I'm going to be doing a shoot. I messed up those terms. Next, I'm going to be doing the 2-point discrimination. That last one was the point localization. So I'm going to have you go ahead and close your eyes, and you let me know if you feel 2 pricks or just 1.
Okay.
Okay?
2. 2. 2. 1.
Great. All right, now doing the other hand, or I would do that bilaterally. Perfect. All right, so next we're going to move on into some coordination testing. So the first thing I'm going to go ahead and evaluate is if you can pat your hands against your thighs and flipping them over. Great. Next I'm going to be evaluating your hands or your fingers, so go ahead and touch each finger to your thumb and back. Great. Awesome. Next I want you to go ahead and tap your foot against my hand. Great. Great. All right. So next we're going to be doing a point testing. So with this, I'm going to have you touch your nose and then touch my hand or my finger. Great. 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 All right. Next, we're going to do a finger-to-finger exam. And so what I want you to do is start with your finger back here and then touch my finger. And one more time. And with your eyes closed. Great. All right. All right, then I would do that bilaterally. Perfect. Next, I want you to go ahead and stand up, and I'm going to assess your gait. So go ahead and walk to the door to me. All right, so I'm just making sure that the length of the gait is great, the arm movements are great, as well as the leg movements are continuous and smooth, and also making sure as she is pivoting around to come back to me that her head is leading her walk. So that was good. All right. All right, next thing I'm going to go ahead and evaluate is some more walking. And so what I want you to do is just go on your heels and then switch to your toes. Great. All right, so next thing I'm going to go ahead and do is I'm going to kind of be right here just to make sure that you don't fall over and you're nice and stable. But I just want you to bend one knee and go down. Great. And the other. Awesome. All right. Next, I'm going to be doing the pronator drift test, and I'm going to have you stick your hands out and have you close your eyes and just making sure that the arms are coming back up. All right, next I want you to just go ahead and hop on one foot in place and the other foot. Great. All right, next I'm going to be testing, doing some special tests on you. So I'll have you go ahead and lay down. Okay. First all the way down. First I'm going to be doing the Brzezinski's sign test. And so I'm just going to kind of flex your neck forward and let me know if you have any pain, okay? Mm-hmm. Any pain with that? Nope. Great. All right, next I'm going to do the Koenig's sign test. And I'm just going to lift your leg up, bring it to 90 degrees, and let me know if you have any pain.
No.
Great, now we do that bilaterally. Next, I'll have you go ahead and sit back up. Oh, yeah. All right, so next, I'm going to have you go ahead and stick your arms out, and I'm going to evaluate for any sort of winged scapula here. Resist my motion. Great. Oh, yeah.
But that was good too.
All right, now I'm gonna go ahead and assess for asterixis. And so I'm gonna have you stick your hands out again and spread your fingers apart and just making sure that there isn't any movement of the hands. Perfect. All right, now we're gonna go ahead and move into some reflexes. All right, so first reflex I'm gonna test is your brachioradialis. So I'll just have you go ahead and relax your arm. Great. Awesome. Next, I'm going to go ahead and do your triceps. Okay. So I'm just going to be tapping on the back of your arm, okay? Great. Alright, awesome. Next, I'm going to be doing your biceps. So just once again, let your arm go limb. Feeling for the biceps tendon. Alright, awesome. And so far these tests have all been 2. And so the reflexes are there, so that's great. Alright, next I'm going to do the patellar tendon. Okay. And so I'm just going to tap on your knee. Okay. Just go ahead and let your legs go nice and limb. A little bit of a tap here. Alright, I'm going to have you go ahead and clench your teeth and pull your arms apart. A little bit better. It's not going. Alright, I'm going to do the other side. There we go. All right, perfect. Next, I'm going to be doing your Achilles tendon.
Just a little bit.
Oh, that was a good one. Awesome. All right. Next is the plantar fascia. Yes. Oh yeah. All right. So I'm going to be testing for Babinski's. All right. Great. Awesome. All right. Next is the ankle clonus. And for this one,
Just go down, down, down. Down, up, down, up, down, up.
oh yeah, that's right. All right, so for ankle clonus, all right, just relax your leg and your foot here. 1, 2, 3, up. Perfect. 1, 2, 3, and up. Awesome. All right, and that concludes all the reflexes. So, oh, the last one, actually, just kidding. The last one is the abdominal reflexes. So I'm going to be laid down. Perfect. All right, doing all 4 quadrants. Awesome. And those reflexes were all 2, so
Great.
they were all intact. So I'm not worried at all.
Cool.
Do you have any other questions or concerns or anything? All right. Well, thank you for your time.
Yeah, thank you.